World AIDS Day celebration coming on the 1st of December. And all the activities we have been embarking on since we started putting people on treatment. We are today embarking on the HIV and AIDS rally and walk to be able to show up the message that HIV and AIDS is real, that new infections are occurring, that people are dying from HIV despite treatment. Many people have been put on treatment, so nobody should die from AIDS today. But still, people are dying out of ignorance, out of complacency, and relaxation. The message of prevention is still relevant. Abstinence, being faithful to your partner, using condoms, and then delaying early sex among the youth. To continue the development of our country, Ghana, for the 32 million people, we need everybody to be in good health. And we need everybody to be free of disease. And so today, we are continuing in the messaging that HIV is real, protect yourself. So we have gathered here today, first of all, to increase our knowledge and advocacy on HIV, to improve our health and well-being through the work, and to take messages. The second reason is that on December 7th, we are going to cast our vote. This work was organized in collaboration with the political parties, led by Garnet. And we are giving the political parties an opportunity to commit to HIV so that irrespective of the outcome of the election, for the next government, there will be commitment to buy medications, commitment for advocacy, to inject resources for HIV. So this is the reason why we are here, to increase our likelihood of, to increase or decrease our likelihood of getting HIV and our likelihood of gaining knowledge as far as HIV prevention is concerned in our country. Thank you very much. When I say HIV, say let's end the epidemic. HIV, AIDS. When I say HIV, say no stigma. HIV, no discrimination, and zero new infection. HIV, HIV, HIV. So HIV, no stigma, HIV, zero discrimination, and HIV, zero new infection. Thank you very much, and God bless you.
Thank you very much, Dr. Stephen Aisiado. Owner of car number JR 358124. It's a Toyota branded car. Somebody left some items in your car and the person wants those items. So please attend to your car. JR 358124, Toyota branded car. Please attend to your car so that the person can pick those items from your car. So as part of the guests, we have the chairman of the Ghana Coalition of NGOs in Health, Mr. Bright Emisa Nyako, also here with us. Thank you for coming, sir. So on this note, I'll call on the Director General of the Ghana AIDS Commission, Dr. Tremi Etuahine, to give us an opening remarks. With a round of applause, please help me welcome him. Please, let's give it up for him whilst he's coming. As part of the site attractions, we have the HIV test also going on. You can go and know your status, get tested and know your status. We also have the self-test kits available. You can pick some. So please, let's give it up for Director General of the Ghana AIDS Commission.
Thank you, Mr. MC. Good morning to you all, and welcome to this important event. We are very grateful that you've all made time to be with us today. As you have already heard, HIV is still a major public health threat to our country. And the interesting aspect of it is the fact that more than 98% of Ghanaians are HIV negative. And so our focus is to keep those 98% negative. And the second is to ensure that everyone who lives with HIV receives life-saving prevention, treatment, and care services. And all these services are for free. So on this basis, I say that only those who want to get HIV do get it. Because HIV is not an airborne disease. Before you contract it, there are deliberate actions that you need to take. You make up your mind, you take a firm decision before you can get it. Apart from those who get it from their mothers, and sometimes, through use of contaminated sharps. But majority of people who contract HIV get it through sexual contact. And no one accidentally engages in sex. It's a planned action that leads to sexual activity and therefore unprotected sex with a high possibility of one contracting HIV. Now, we are doing this event as part of the month-long World AIDS Day activities.
Thank you very much. Let's give it up for him. Let's give it up for him. Let's give it up for him. Thank you so much. Understanding group, are you there? Understanding group, are you there? Okay, so we'll be expecting them to come. On this note, I'll call on the rep of the Director General of the Ghana Health Service, Dr. Franklin Esiedu-Bekwin, to give us the keynote address. Please help me welcome him with a round of applause. We want the program to be as simple as such, so that after this we'll have the kinky party. There will also be side attractions. You can get your status, get to know your status by being tested over there. There are so many testing points around. You can also pick up a self-testing kit and go and test at home. So all these are things we are doing so that you can know your status as HIV person.
Thank you very much, Mr. MC. So, the DG Ghana AIDS Commission, Dr. Etuahine, the Vice Presidential Candidate of CPP, lawyer Wayo Ghana Manti, leaders and supporters of political parties, partners in the HIV AIDS space, NGOs, CSOs, the Acting Director, Ghana Health Promotion Division, the PM, NSCP, health workers, media, ladies and gentlemen. Let me say that I'm here in the capacity to read for the DG of Ghana Health Service. So I need to read because this is his statement. So I'm not going to say things from out of my head. So I'm here today. I'm here today for the World AIDS Day rally under the theme, Take the Right Path, #EndsAIDSNow. As a country, we've come a long way from the time HIV was seen as a death sentence to now, over 20 years of using antiretroviral therapy. The journey has not been smooth though. As at the end of December 2023, over 330,000 persons are living with HIV in Ghana. About 65% of these persons know their status, and of which 69% are on treatment, with only 89% of them achieving viral suppression. The goal of National AIDS Response is to have 95% of people living with HIV know their status, 95% of those know their status to receive antiretroviral medication, and 95% of these persons to achieve viral suppression by the year 2025. We have challenges of commodity insecurity. There's a need to improve data management systems and human resource capacity. We need to sustain the progress made in the fight against HIV/AIDS in Ghana, and that means we need to take ownership of our health financing. The National HIV and AIDS Fund represents a transformative approach to ensuring this critical intervention is achieved. By prioritizing domestic resource mobilization, we reduce dependency on external donors and build a more resilient health system that serves the needs of every Ghanaian. There's a need to champion increased domestic financing as a pillar of national development. Investing in the national HIV response addresses a pressing public health challenge and strengthens Ghana's ability to respond to future health crises. One area of importance is the triple HIV, syphilis, hepatitis B transmission from mother to child. A Ghana where no child is born with HIV, syphilis, or hepatitis is within reach if we act decisively. The Triple Elimination Initiative is a global commitment, but this depends on local investment and leadership. As stakeholders, including political leaders, we must champion policies that significantly increase government and domestic investments to help prioritize antenatal care, early diagnosis, and timely treatment for pregnant women, to break the chain of transmission and ensure a healthier future for our children. Payment of co-funding obligations to the Global Fund. Let me state that the Global Fund has been the indispensable partner in Ghana's fight against HIV, TB, and malaria. However, continued access to this support hinges on meeting our co-funding obligations. By fulfilling these commitments, we demonstrate our commitment in tackling health challenges and as a reliable global partner. There is therefore the need to ensure that these payments are prioritized in our national budget. And this we want to urge all political partners or political leaders to ensure that this becomes a clear reality. Donated health commodities save lives, yet levies and taxes on these donations create barriers to access. Eliminating these charges will be a bold step towards strengthening health systems and reducing patient costs. This practical, efficient policy shift would immediately benefit millions of Ghanaians through the prompt import clearance of donor financed commodities. The absence of prompt tax waivers on donated health commodities undermines the very purpose of their contributions to save lives and improve health outcomes. By removing these levies, Ghana will send a message of commitment to health equity and effective resource mobilization. I call on all gathered here today, including political leaders, to support this measure and ensure that donated resources promptly reach the people who need them most without delay. Ghana will be hosting the 23rd edition of the International Conference on HIV, AIDS, and STIs in Africa, ICAS, from the 3rd to the 8th of December 2025. This event will bring together global leaders, community researchers, advocates, and healthcare professionals to further the continent's fight against HIV, AIDS, hepatitis, malaria, TB, and emerging viral infections, and strengthen Africa's health systems. This will be the first time a West African country will host the event. Hosting ICASA 2025 will position Ghana as a leader in the global health community, showcasing our achievements and commitment to advancing HIV and STI prevention and treatment. This will be an opportunity to attract international partnerships, investments, and recognition, all of which will benefit the nation. Supporting this event will demonstrate political commitment to health advocacy and create lasting economic and social benefits. I urge all of you gathered here today to fully support ICASA 2025 to make a success for Ghana and the continent. I thereby, on that note, urge all of you to ensure that Ghana becomes free of HIV. Let's end HIV AIDS in Ghana. Thank you very much.
Thank you very much, Dr. Esie Dubekwe, who represented the Director General of the Ghana Health Service. Thank you for coming. Thank you for coming. So we also have the President of the Network of People Living with HIV AIDS, Madam Elsie Aye here. If you are here, let's see you. She's here with us. Thank you for coming. Then we had a team from Abbott, also here, one of our key sponsors, and they are led by Mr. Samuel Dankwa, country manager for Abbott. Abbott team, thank you all for coming. So understanding team, if you are here, please come and see the DJ. We want to see you. Come and see the DJ. We are now moving to the CSOs, and I'll call Mr. Bright Amisa to give us a word on behalf of the all CSOs networks in the country. So please help me welcome him with a round of applause. Understanding, if you are here, please see the DJ. And Director General of Ghana AIDS Commission, let me apologize on behalf of the DJ. It was a technical hitch that they interrupted with the music, so please forgive them for that. They are sorry, and we are really sorry for that.
Thank you, Mr. MC. Good morning, all of us. The Program Manager, NACP, the Director General, Ghana AIDS Commission, the Director of Public Health, representatives of all political parties gathered here, my CSO colleagues and network leaders, ladies and gentlemen, I bring you warm greetings from Ghana Coalition of NGOs in Health and all the sister networks. Stop TB Partnership, let's see you. Malaria Coalition, let's see you. Garnet, the organizers of this event, they are all here. We thank all of you for coming. But we want to re-emphasize that HIV is real. If you heard the program manager, 900 people are dying every year. And these are preventable deaths. Never again should we allow ourselves to die out of HIV. There is enough the country is doing to prevent these deaths. Nobody should die of AIDS. So we have to marshal our efforts, use the condom, abstain, and be sure we don't die of AIDS. The fight against AIDS and HIV is not just a social fight as we see here. It is also a political fight, and we need those political commitments. That is why our political leaders are here today. You need to prioritize HIV when you assume office so that you help the programs to fight this menace and eliminate AIDS. I want to call on all of us and the youth that we can eliminate AIDS by 2030 if we are able to reset our lives. I am telling you, it is possible. So all of you gathered here, let's find a way and means to contribute our quota to eliminate AIDS in Ghana and then stay free. Government, we also want to say our effort in fighting HIV and AIDS includes the flow of commodities. Under no circumstance should we hear again that there is going to be shortage of any form of commodity, including condoms and all other things we use in fighting HIV. On that note, we say thank you very much. Let's reset our lives and make it possible to eliminate HIV by 2030. Thank you.
Thank you very much, Mr. Bright Amisa, representing the Coalition of NGOs in Health and the CSOs here. Thank you for that message. So we'll take the next message from Madam Elsie Aye, President of the Network of People Living with HIV AIDS. Please, with a round of applause, help me welcome her with a... Please, let's do it better. She's coming. Let's do it better for her.
Thank you very much and good morning, everyone. I want to thank you all for joining in this walk. And we are so grateful that we have such a great support. I'm speaking on behalf of the persons living with HIV in Ghana. The whole of last week, we were in the northern region, in 2 districts in the northern region. And it's alarming the extent of stigma. We had to call people to come and meet us in some enclosed place before they were willing to come. But after we interacted with them and they understood that they were just like anybody else. And it was just stigma, but it has to work with us first. Begin from us first. They were able to put their acts together. They were able to pull themselves together. And by the time we finished the meeting, everybody was smiling. And they felt so happy that people supported them. So I'm speaking on behalf of persons living with HIV. Please stop stigmatizing us. Stigma kills. The medication helps with the treatment, helps keep us well. But the stigma from outside kills. And also, one very surprising thing that happened that we got to know is that in almost all the health facilities we visited in the 2 districts, the stigma from health care workers is also high. And that came out so clearly, so clearly. We need to work on this. So I want to use this opportunity to appeal to all and sundry. Please stop stigmatizing against us. Next year, I'll be 30 years living with HIV. And I'm all right. I'm on treatment. So please, stop stigmatizing us and let us take our medications, feel strong, and be able to also play our role in the growth of the country. Thank you very much.
Thank you very much. Thank you very much, President. We need to stop stigmatizing people living with HIV AIDS. That was a key message from the President. Thank you so much, Madam. So we'll move on and take the next message from Madam Masego Kotani, who is the Marketing Manager for Central and West Africa for Abbott. Please, with a round of applause, help me welcome her. Please, let's do it better as she's coming. Let's do it better for her as she's coming. She's coming with the Abbott team, one of our key sponsors for this program and other HIV programs that we've held this year.
Thank you very much. Well done to Garnet on the health walk today. Abbott is proud to be a sponsor during the health walk 2 years running to raise awareness around HIV and AIDS, as well as the importance of testing and the role that HIV self-test can play in getting people to test and know their status. Thank you all for allowing us this opportunity.
Let's do it better for them. Let's do it better for them. Thank you very much. That was very brief, and we hope that they'll continue to support this. DJ, please give us a musical interlude.
and I will do anything that you wish. Me share my boss, so don't pay me for it. No years that tomorrow, somebody else come take you for it. They do me no more. This thing no be normal. Me no want to do more. This don't give me trouble. You get do me no more. This thing no be normal. It go be my lover. It be like power. Pick you up in the foreign. Bring it on what is on your mind. You're being it is a bunny and kind day. And all that you promised to show and tell me to now what's going on right there.
Okay.
You are my favorite story. I know if you tell her this going, but
Thank you very much, DJ. Thank you very much, DJ. We are in a political year, and we thought it wise to give all the political parties the opportunity to come and tell us their policies about HIV when they come into power, or should they win power in the upcoming elections. Luckily for us, today we have Honorable Alfred Nikote Ashi, the NDC parliamentary candidate here with us. Let's see, Honorable. Honorable, so please come and tell us something. Let's welcome Honorable with a round of applause, after which we have Mr. Wayo Ghana Man Inti, the CPP running mate, also here with us. He also come and share some few words with us. Please help me welcome the NDC parliamentary candidate.
Thank you. Eyazu, Eyazuzu, Eyemefa, Mlamie, Mlamie, Mlamie. God bless you. I would like to thank the Almighty God for making this day possible. I also say a very big thank you to all the organizers of this program. It has come at a very important moment. And for those of you who funded this program to make it happen, may your resources be replenished in multiple folds so you help other communities as well. God bless you all. I understand that HIV is a very serious situation that we have battled with over the years. I know as well that several interventions has been established to get us where we are today. I believe we should go back in time and do proper reflection of what we have done, identify where we did best and which approaches didn't work, so we revised them. HIV will not kill you today, even if you have it, because I know there is hope. We have antiretroviral drugs that will sustain you and reduce the viral load. Ke oyebi mene bomoding ni op test o status for HIV. Keji o test ni obe koe wabada nyungoshin. Then obafe non wachole P, which is prevention. Ke o prevent HIV. But what you do is, in the past, we used to have the A, B, and C approach, where A is abstinence, and then B is being faithful, and then the third one is condom use. I believe it still works. The war, keji o test ni obe koe, but no oba use, ene meno ke prevent oye from acquiring HIV. Keji o test ni oye ko hue, kayo tree, ebegbeye don, abanye ni ahabo chofa, ni ba sustainable. Ene hewo ka shegbeye, ake obaya test. It is important. Ake obale o status. Kondo na whether sando kocho fanko jiu, keje na kaini oye kodo kenye keke. Ibagbebo no lo hebe. Coming to what I'm going to do. HIV situation, it's a whole behavioral change communication package. It's not just about creating the awareness, but once we've alerted the people, created their awareness, we need to reach out to them, because Jame or Femo, it isn't everyone who have the courage to even want to come out. And that is why, as a member of parliament for Ododo, God willing, I will institute HIV peer education within our communities, where we'll identify peer educators who reach out to their peers, dialogue with them, get them to understand the need to go and test. Also, I will ensure we train among the same peer groups, peer counselors, where people in the communities or their peers can reach out to them when they have issues for counseling, because peers communicate easily among themselves because they relate well enough. Thereafter, I will ensure that we identify young role models and opinion leaders among them to serve as supervisors, peer supervisors, who collate information and report to my office. So we reach out to them and act accordingly. To do all of this, I'm going to establish a youth development center in my constituency, where we will train young persons in life planning skills. We provide counseling for them. We will also ensure that we'll do role model for them so they can aspire to reach out to be somebody or some people in future. We will use that same establishment as a counseling unit to educate and counsel young people with respect to HIV and AIDS. By doing so, we'll be able to reach out to them. We'll have activities like community drama series to educate them and do well to take the fight closer to the people. Once you're able to get to them, we will get the information we require. We'll be able to give them confidence in testing, and then also ensure that those of them who have it, we will make sure whatever information we have about them is private. Because one of the key challenges we have is confidentiality. Most people fear that, if people get to know within the community, I'm finished. So they won't go out there to test. But once we assure them that whatever information they provide to their peers at the counseling center is secured, it's private and it's confidential, they will come out enough to also join in testing and also campaigning for the fight. I will ensure, finally, that every young person in my community will be registered on the NHIS, and have the cards so they can easily access health care as and when they need be. My major focus will be to establish the Youth Development Center, train peer educators, peer counselors, and activity supervisors so we can champion the cause, and we'll work with all of you, all the stakeholders here, to ensure a better result. God bless you all.
Thank you very much, Honorable. Let me emphasize that the organizers extended an invitation to all the political parties. So we'll take messages from all of them as and when they are made available or they avail themselves here so that they can share their vision with us. We have Mr. George Amoa, GCPP, National Organizer here. Please come and share your message with us, GCPP, National Organizer. Mr. George Amoa. Please, are you here? Thank you very much. We hope that it will be very brief.
Thank you. Good afternoon. I'm George Amwa, the National Organizer of Great Consolidated Popular Party, GCPP. And we believe in domestication. And what is that? When I say GCPP, you say domestication. I say GCPP, eat what you grow what you eat. That one, GCPP, emancipate papa. Then the last, GCPP, Piso. This is a greeting from our flag bearer, Dr. Augustine Latte Jr. He's on number 2 on the ballot box. So on December 7, when it's time for you to vote for GCPP. Vote for GCPP. We are number 2. This afternoon, what we have to say about the AIDS epidemic situation in this country is that we are going to produce the drugs here because we believe in domestication. And according to what the AIDS people are saying, most of their drugs are being donated by the Western donors. Now, as a nation, after 55 years of independence, and we cannot produce our own drugs, and somebody is producing that for us. And if the Ghana Global say is no more going to produce the drugs, what are we going to be? So we have taken the mandate that as soon as we come to the power, we are going to let local producers to produce drugs for us. And those who are coming from outside, from the Western donors, as soon as the drugs landed at the port, there will be no delay. Thank you.
Thank you very much. Mr. Wayoga Naman Inti, CPP, running mate. Please, are you here? Come and share your vision with us. Please help me welcome him with a round of applause.
So boy, CPP, any emerse yebekasa bebre. Yes, I depend on ho. Osajifo Dr. Kwame Nkrumah's Convention People's Party doesn't need to say much. So if I say CPP, just say freedom. We have gained the political freedom. We are still managing with the economic freedom, which HIV AIDS prevention is one and part. A healthy nation will beget a healthy citizenry and then a boost in its economic journey. So when I say CPP, say freedom. CPP, please, I want, when somebody came here and said zoo and the rest, you are just, when I say CPP, just say freedom. CPP. CPP. Just across here in 1957, Kwame Nkrumah did the same thing. Just across Polo Grounds. So please, on these grounds today, CPP is being echoed. So sing along and come along. Very well, I bring you greetings from the Convention People's Party. My flag bearer, Nana Frimpoma, Akusia Frimpoma Sapon Kumankuma. She was supposed to be here. She went to Kumasi. I'm thankful to the organizers and Director Sedi Bekwe and his team, the Ghana Health Service. We want to assure you that a Convention People's Party's government will take the citizenry and their issues very important. HIV has been with us. And when we were quite younger, we saw a lot of adverts and sensitization. So I was telling Director that I thought it was gone because I was not seeing the adverts anymore. 20 years down the line, we were seeing a lot of adverts. The NDC PC was here. He's a young man like myself. So you can see, CPP is ready to bring young people to move into governance to move this country forward. Everything the NDC PC said, he said it as a PC. The difference between what he said and what I'm going to say is that I'm saying it as the vice presidential candidate and a possible boss of the economic management team. So what I say here today, don't look at me as a young man. Don't say this young lawyer. This young lawyer, you see him as boys. What I say here is the man who is going to lead the economic management team saying it right to Ghanaians. Our first step is to embark and support the Ghana Health Service in respect of prevention. All preventable diseases, we want to assure the Ghana Health Service, by extension the Ministry of Health, that a CPP government is going to consciously embark on that journey. In the 1960s, we sent nurses to Israel to train as TB nurses. They came back and were referred to as TB nurses. We want to assure you that a CPP government will have disease prevention experts. Disease prevention experts. It will be up to the Ghana Health Service to now segregate and disseminate where these experts will be, whether it's sanitation, whether it's TB, whether it's malaria, whether it's HIV. But the point is that when we outroll the disease preventive experts portfolio, we leave it to the ministry and then the health service to deal with it. That will tackle the issue of prevention. We are vigorously going to go down to the grassroots. We'll begin with the youth. We'll go down to the primary schools. We'll go down to the junior secondary schools. We'll go down to the senior secondary schools and begin to prevent HIV and all preventable diseases from that point. They said, catch them young and they shall grow. When we begin to let our young ones understand that HIV is real and the best way to save yourself, the best way to protect yourself is to prevent getting into it. With the experts, the Ministry of Health and then the Health Service and the Ghana AIDS Commission will put across, you will see that we are tackling prevention issues right from the grassroots. So all issues about prevention, we'll leave it with the ministry and then the health people. They are the experts. I'm a lawyer, I'm not an expert. We'll leave it with them and they will outroll all the models of prevention. So that is how vigorous we are going to deal with prevention. Then we come to the second phase where we think that citizens who for one or two reasons couldn't prevent preventable diseases and get caught up, we will now outroll how we can help them deal with it as a nation. So another area we are going to be concerned is the production of medicines locally. I'm excited that the New Patriotic Party has helped the Narcotics Control Commission to amend the laws. So today in Ghana, we have a chamber of cannabis industry. We can use cannabis for medicinal purposes and use cannabis for industrial purposes. A CPP government will vigorously follow what the MPP has left in respect of the chamber of cannabis, help our pharmaceutical companies, Tobinco, Kama, and all those companies to be able to help us produce the medicines locally. And therefore, we'll be producing all array of medicines for preventable diseases. This is how vigorous a CP government is going to approach issues like HIV AIDS in Ghana, alongside all other preventable diseases. Give the CPP a chance. Since some men in uniform toppled our government, Ghanaians have not tested us. You don't know what we can do, but you knew what we did, and you know what we can do. On 7 December, vote for Nana Frimpoma, number 7. backed by her young, energetic lawyer, Wayoga Namaniti, to bring the youth of this country to enjoy work and happiness. When there's work and happiness, HIV is a thing of the past. When there's work and happiness, malaria is a thing of the past. Give CPP a chance. Freedom.
Thank you very much, CPP. Let me explain this. As part of this program, the organizers extended an invitation to all the parliamentary candidates in this constituency to come and share their vision with us. An invitation was also extended to the national leadership of the various political parties to come and share their vision with us. What the NDC parliamentary candidate came to do was to share his vision for his constituency. We are also privileged to have the NDC officer from the national office, Dr. Winfred Barr, to share their policies with us. So he's from the national office. Please, with a round of applause, help me welcome him to share those words with us. Please, let's do it better for him as he's coming.
Thank you very much, MC, and permit me to stand on the existing protocols. And let me say we are happy to be here. I want to also thank our PC for Odododio for his kind words. I bring you greetings from His Excellency John Dramani Mahama, the incoming President of the Republic of Ghana. I thought you would clap about that. We want you to know that the next NDC government will be committed to the cause of HIV and AIDS and the fact that we want to eliminate it by the year 2020 and sustain the response. To this end, the NDC has a lot of policies to address that. And we know to do this, we need to talk about education, we need to talk about prevention, we need to talk about testing and treatment. And funding is key when it comes to eliminating new infections and sustaining the program. What is the NDC going to do? Number one, His Excellency John Dramani Mahama is saying that he's bringing free primary health care, which means that from the health centers to polyclinics, everything will be free. What it means that HIV AIDS care will be integrated so people can have access for free. We are also going to strengthen the National Health Insurance Scheme. When it comes to funding, we are going to help get internal sources apart from what the Global Fund is giving. One of the things we are going to do is to uncap the National Health Insurance Scheme. Already, we all know that only about 25% of the NHIS levy is released to the National Health Insurance Authority for work. But John Dramani Mahama is saying that he's going to release 100% of the funds. And so some of these will go to support HIV care. Now, we are also going to have what we call the Mahama Care, which is a fund that is going to support chronic diseases like diabetes, heart diseases, and the rest. And we all know that people with HIV and AIDS have complications. One of them is what we call HIVAN, which can lead to end-stage renal disease. So people with HIV who have kidney failure can also have dialysis for free. And so His Excellency is saying that he wants all of you to vote for the NDC because we have a lot of good policies for you. Come December 7th, we want you to vote for number 8. Look for the umbrella and vote for His Excellency John Dramani Mahama. Thank you very much.
Thank you very much, NDC National Office. Ms. Malaika, please come and give us a message. Please help me welcome our National HIV Ambassador to share some few words with us. Let's do it better for her, please, as she's coming.
Good morning, everyone. I am so happy to be here today, and I'm also very happy to be part of this wonderful family. You know, I was a bit sad during the walk when a young man approached me saying that he would have loved to take pictures with me and he would have also loved to take my contacts. But the only thing holding him back is the fact that he heard I work with the Ghana AIDS Commission, and so he is scared. As Madam Elsie said, persons living with HIV are taking their medication. But one thing that is killing them is the stigma and discrimination. We all need to understand that HIV is no respecter of person and anyone can get it. I am the representative of the youth, and I have pledged to use my platform, my influence, my image to fight against HIV when it comes to the youth. And I know I can't do it alone. So if you are here and you know you fall under the youth category, know that I am working with you. We all need to come together and fight against HIV. Thank you.
Thank you very much. Thank you very much, Miss Malaika. So this brings us to the end of today's program. Mr. Toniado, you need to give us the closing prayer again. So let's take note of this announcement. Remain in your groups. Just as you came, just remain in your groups. You'll be served. So from here, don't move. Just be in your group so that you can be recognized and served before you leave here. Then the testing is also going on. If you've not done, just make sure you pass by, get tested, and know your status. The self-test kit is also available. You can pick some and give some to your relatives at home who couldn't come. So thank you all very much for coming. We'll take the closing prayer.
Shall we pray again? Yehovah, what word he what to nuchumone what ni odromona ohani no fiano enyete no. Okawa bana agbe no wa to he what akebia mi ni wa ba shibie. Noncho okemofia mo ya she ni eje iba. Kodi wo fen wo keshida ahabo. O mi ndabo shi ke wo ba pe ko noncho efe no koni ba fe dio akeshi wonye wona hewale. Ni wonye wonno. The one you work at HIV AIDS, we are ne fan baba nagbe. No bo way, no yo bow. Yabo Christo family. Amen.
Thank you very much for coming. There's going to be a lot of fun. We have Papillon Blood here. Where is he? He's around. He's also coming to perform. Then we have Nifani also here. They are all coming to perform. So please, cut the fun. Don't leave here. Make sure you entertain yourself before you leave here. Thank you all so much for coming, and God bless us all. Papillon or Nifani, are you here?